Hi, welcome to today's episode where we will be talking about pressure care management with beds. Looking at things like our profiling beds, what are some of the features, accessories, or techniques when we're using our profiling beds that can help with pressure management. So we'll talk about things like your auto-regression, your knee break, your head raise, and what are the guidelines for pressure management. So when we're looking at pressure management, a very important thing is pressure relief, which we get through repositioning. If we reposition in bed, that is something that's going to help offload areas and redistribute pressure. But when we think of bed mobility, this could either be the client being able to reposition independently, or it could be the bed assisting caregivers to reposition a client. So when we look at things like your modified Trendelenburg, which is almost like a tilt in space type of movement, where we have a head raise and the legs are lifted higher, this is allowing us to reposition the person where pressure is not going through the buttocks as much, but we're transferring a bit more over onto the back, which is a larger surface area. And your Trendelenburg, modified Trendelenburg, is also allowing the caregivers to use gravity to assist the client to move up on the bed. So it's making their work a little bit easier. And if it's easier for caregivers to reposition a client, they're more likely to do it regularly. We also look at things like your bed that can raise high enough, because if we have a bed that's at a very good height, caregivers don't have to bend down as much. So it's less of a strain on them, and therefore easier to do that repositioning. But when we look at what is easy for the client as well, if they are using that handset, they can even go into that tilt in space movement and reposition themselves, have that pressure redistribution from the buttocks onto the back. They can bring up the knee break to take off a bit of pressure from the heels and rather have it over the calves, which again is also a larger surface area. So having a bed that can profile and has a handset allows someone to be able to do that. We also mentioned auto-regression. So auto-regression is where our bed is actually growing in length. So when we sit up in bed and lie back down, we have lengthening and shortening of our muscles. So when we sit up in bed, we don't want to have the bed move on a hinge system, because we don't move on an exact hinge. So what happens is, instead of your knee break and your head raise moving on a hinge, they actually kind of move away from that middle section where the pelvis is. So we get lengthening within the bed, which prevents shear and uncomfortability for the client when they're sitting up. And it's preventing the person from being kind of pushed and squashed between the knee break and the head raise. Especially with the knee break, it is very important to do the knee break before you do the head raise, because if you were to just do the head raise, the pelvis is going to start sliding down the bed, and that's due to gravity. But what's happening is their skin is actually sticking to the mattress. So we're getting pelvis moving downwards, but the rest of the tissue is staying in place. So you can imagine the skeleton and the skin and underlying tissues are moving in opposite directions and causing a lot of damage to the cell structure. So we don't want to have that. We want to prevent that sliding down the bed, and that's what we get with the knee break. It's basically where the section behind the knees are coming up, and it's kind of a block for the pelvis to not slide down but stay stable. So that's very important. But when we also think of the heels, the knee break does help that the heels aren't taking all of that pressure, because the heels are a small surface area with very little padding, where our calves obviously have a lot more tissue. So we have pressure distributed a lot more. When we also look at bed mobility, we do look at things like your accessories. Think of your bed levers, your bed rails, your overhead self-help poles. All of those things are also helping the client to be able to roll in bed, be able to reposition, be able to offload areas where there's discomfort. So whenever we can help a client to be able to shift weight, that is going to help with pressure distribution. Whereas if you had a bed that didn't have those accessories and the client has very poor strength, they're more reliant on their caregivers to have to do that. So it's maybe not going to happen as often as it should be happening. We also want to look at something as simple as the size of the bed. We do have an international pressure injury guidelines that the size of the bed is quite important, because if you have a bed that's not wide enough for your clients, for their anthropometrics or their size, it makes it very difficult for them to be able to roll in the bed safely without the fear of falling out of the bed. So if you have a client on a single bed but they actually really need a king single, it might reduce how much they're actually doing that bed rolling and positioning. So very important that you do get the right size bed. And then we do have very clear guidelines on the actual angles of our head raise, our knee break, and how much we need to turn when we're doing side rolling. So first thing with our head raise is that we don't want to go past 30 degrees. If we go past 30 degrees, this is where we start getting that shear, where the person starts sliding out of the bed. So remember, try and keep it under the 30 degrees. Obviously, there's going to be cases where someone does need to sit fully upright to be able to sit and eat and not have the risk of choking or aspiration. So in some cases, we're going to have to go past the 30 degrees. Important then that we do need to use the knee break to help prevent that sliding. Then we also look at 30 degrees when we're doing side rolling. So when you're rolling someone from, let's say, from their back onto their side, don't do exactly 90 degrees, because that's a lot of pressure going through the hip and the shoulder. So you rather want to cover a larger area. So what you're basically going to do is you're going to roll the person to like a 30-degree angle. So imagine that you're rolling them onto 90 degrees, put a pillow behind their back, and then let them kind of roll back onto the wedge or the pillow, and then they'll be at a 30-degree angle instead. And then it's not they're not directly on those bony prominences. And then when we look at the knee break, this is going to be about 5 degrees, and this is to ensure that we're not going too far and it's uncomfortable for the client, because past that 5 degrees it can be very difficult to tolerate. So don't do an excessive knee break, but very important, head raise, stay within that 30 degrees, side rolling or lateral tilt 30 degrees as well. So let's just do a quick recap of today's episode. So things that we talked about is how can we use our beds to improve bed mobility, not just for the client but also for the caregivers assisting with repositioning. We talked about accessories like your self-help pull, your bed levers, your bed rails. We talked about auto-regression, which is where our bed is lengthening to match the way that our body moves. We talked about the order of how you use these profiling settings, so using your knee break before you do your head raise. We talked about the exact angles that we need to use, which if you remember 30 degrees, it will help. Don't go past 30 degrees for head raise, don't go past 30 degrees for side rolling. If you have any experience with profiling beds in pressure distribution, let us know in the comments. We'd love to hear from you. Stay tuned for our next episode where we'll talk about fall prevention features with beds.